As the coronavirus spread, producers and supply chains struggled to keep up with the increased demand for hand sanitizer, leaving communities without this critically important product. That's when Anheuser-Busch employees at the Baldwinsville, New York and Los Angeles, California breweries quickly set out to transform the manufacturing process and ingredients to immediately produce hand sanitizer and deliver it to those in need. In partnership with the American Red Cross and local government organizations, Anheuser-Busch donated 500,000 bottles of hand sanitizer to frontline workers across 20 states and Washington, D.C. This fall, building on its hashtag Brew Democracy Initiative, Anheuser-Busch donated 8 million ounces of hand sanitizer to state election offices in 40 states across the country to ensure election officials and voters could take part in a safe election. Last spring, as the pandemic began, a challenge was issued to data scientists. Create AI tools to help medical researchers and practitioners find the information they need in the rapidly growing set of COVID-19 medical research. Erickson volunteers answered the call.
We sent out an email calling for volunteers. We thought we'd get 20 or 30 hands up, and said we got about 400.
They formed teams to develop a set of AI-driven tools that allow medical researchers to ask specific questions about topics like risk factors or non-pharmaceutical interventions. The tools find and summarize the most appropriate papers to answer the researchers' questions from what started as a set of roughly 30,000 papers and has now grown to over 200,000 papers, more than any researcher could possibly read through.
A resource like this that can synthesize all the available knowledge and boil it down in a way that allows me to have actionable insights and also trust that it's coming from, my medical community, the source of high quality information, really helps guide me and make the best decisions I can for my patients.
The tools have been released into open source, enabling doctors and researchers to quickly find the information they need to lessen the impact of this virus. As Americans fell on hard times, with many losing their jobs at the onset of the pandemic, local food banks faced a shortage of supplies to keep communities fed. Nestle saw this as an opportunity to act on its purpose, to unlock the power of food to enhance quality of life for everyone by feeding the most vulnerable in communities across the country. Since mid-March, Nestle has broadened its base of key partners to include the American Red Cross, James Beard Foundation, Meals on Wheels, No Kid Hungry, pet welfare organizations, hospitals across America, and more. To date, Nestle's U.S. brands and businesses have donated a combined $6.9 million, 6.5 million pounds of food, and 10.3 million bottles of water to charities, food banks, and nonprofits in the communities in which it operates. Additionally, within the company's walls, supporting its employees' well-being and health has been a top priority and has allowed Nestle to prevent outbreaks and keep grocery store shelves stocked at a time when consumers need it most. Siemens USA has continued its commitment to supporting states and communities in the fight against COVID-19 and its devastating impacts. Siemens USA is focused on ensuring that no American or any community is disconnected from essential services, and right now, no service is more essential than healthcare. Faced with COVID-19's devastating effects, the Siemens Foundation rapidly pivoted its focus to health equity and provided a total of $2 million in critical financial aid, including funding from Siemens Healthineers to sustain the work of 20 community health centers across the country that are meeting the healthcare needs of those who are disproportionately poor, chronically ill, and disenfranchised. The Foundation is committed to supporting these critical health care providers so they can continue to serve their communities, recover and rebuild from the pandemic, and promote diversity, equity, and inclusion in communities most affected. In total, these grants reinforce Siemens and the Foundation's resolve to support communities across the U.S. in the face of this crisis. Volkswagen formed the Community-Driven Promise Initiative in March to address the financial concerns of its customers, the need for personal protective equipment in hospitals, and the challenge of providing essential supplies to vulnerable communities. Volkswagen Credit employees adapted payment systems to support financially insecure customers, while Volkswagen purchasing, production, and engineering executives worked with suppliers to adapt operations toward relief efforts. Volkswagen's strong relationship with Forcia allowed the companies to transform manufacturing to produce an estimated 250,000 masks and 50,000 gowns each week that were shipped to hospitals across the country. Volkswagen Chattanooga made use of its education labs to 3D print mask holders for medical workers in the region. Volkswagen also supported over 600 independent U.S. Volkswagen dealers who put their service loaner fleet to use for free pickup and delivery of needed supplies and food in their communities. Volkswagen employees from all different areas of the organization brought their various skills to the table to work toward achieving the community-driven promise throughout the pandemic.